Welcome. My name is Corinne Waldow. I'm the Economic Development Director for the Boulder Chamber, and I want to welcome you today to our office hours for a combined limited healthcare and personal services. As you saw, we've combined these two and added an additional session at 4 o'clock for gyms and recreation and personal training. So if you'd also like to join that one, please join that. I want to thank our partners in the economic development and the chambers across the county for making sure our businesses are safely reopening for our health and for our economy. I want to thank Boulder County Public Health for offering these hours every week for businesses to get your questions answered, to give you any new information if there is any, and to provide opportunities for feedback. And I want to encourage you to continue monitoring these webinars, receiving the resources, because things will change in the future, and it's important to have that information. At this time, I'm going to hand it off to Jesse Rounds with Boulder County Public Health.
Thanks, Corinne. My name is Jesse Rounds. I'm one of the business liaisons with limited healthcare for Boulder County Public Health, and I'll start the presentation off just again doing a quick review, some overview of the situation, and then we'll dive into more specifics as we go along. So I'm going to give you a couple updates. We'll talk about resources, we'll get to your Q&A, and then we will dive in at the end to trying to address specific questions that you have. A little bit about the timeline here. So right now we're just at the end of May, and as many of you know, yesterday the governor released information or released an announcement about camps, day camps for kids and restaurants. But this started all the way back, May 22nd. The county released their face covering order. On the 25th, the Safer at Home order was extended. I'm sorry, yeah, then that's yesterday. And then at the same time, the camp and restaurants were updated. And June 1st is, like Corinne said, when we're likely to see next steps for Safer at Home. In terms of Safer at Home, this is an example of it evolving. The governor did not rescind Safer at Home. He and his team expanded parts of it and sort of extended areas of it. And that's going to be the way it is for quite some time, likely months until we're able to develop a treatment, find a vaccine, or reach herd immunity in the community. And the reason for that is that COVID-19 is still just as contagious as it was in January, February, March, April. We are encouraging people to stay at home. The governor is encouraging people to stay at home as much as possible. And just as a reminder, the face covering order for Boulder County and generally for the state is still in effect. Speaking of that, the mask face covering survey that the chamber and Boulder County put out, we got 381 responses, and that information helped us craft and put forward an extension to the face covering order. And I just want to go over a couple slides of the responses that we did get. And in terms of physical distancing, most businesses are reporting good physical distancing and even great physical distancing. And the deal there is good physical distancing is 6 feet. Great is, I guess, 100% people doing that. And then fair and poor are less than that. Like I said, that's a pretty good indicator there that people are generally following the order and the sort of recommendations of Safer at Home. In terms of face covering, opinions of the respondents, generally, again, very positive about the face covering order, and that's why we felt comfortable extending it into the future. And businesses reported really very positive information about customers coming in with face coverings and maintaining that mask face covering throughout their visit. And again, that's a really positive sign for us. And here, just comparing us to our surrounding communities, the communities that do not have face covering orders in place are seeing much lower compliance than Boulder County. And that's just a quick, this is where face covering orders are in effect and where we're seeing changes in the new cases over time. It's just some suggestions and maybe a little bit of specific, and Cami, I've lost count of the number of slides we're on, so I don't know if you're supposed to, but I'll just keep going through this section. One of our recommendations is to bring a face covering whenever you leave your house. That way you can be in compliance regardless of what the specific business you're going into rules may be. And that can really be borne out for us within limited healthcare and personal services. Both staff and patients must wear masks at all times while in the business. The differences are that for personal services businesses, cloth masks for both employees and patients are fine. For limited healthcare, if you're an employee, if you work for the business, you need to be wearing medical grade or surgical masks, whereas your patients can be wearing cloth masks. And one caveat that I think we had sort of different guidance on in the past, but I really want to focus on now is if you are inside your business, alone in your office, or one of your employees is working alone in their office after hours or even during the day, but they know that no one else is coming into the office, taking off your mask is fine as long as you're in an enclosed space. But have it nearby, again, because if someone walks into the room or if you need to get up quickly, having it close by will really be a benefit.
And I'll just quickly add to that, just for a clear definition, the enclosed space really is 4 walls and a door.
Yeah.
And that it needs to be able to be put on quickly if someone walks into the room, which I know came up for pet care providers or other high or low contact kind of providers. Let's just make sure it's available, and that you are allowed to give customers masks as long as they're reusable, if never been used, can be only one-time use masks, but they're not necessarily required for you to provide to your clients or customers, because obviously sourcing some of this PPE has been difficult. And that from as many of you as possible, messaging that up front, which I think a lot of you are doing well, which is why we're having such high compliance, is to let your clients and customers know when they're booking appointments, if that makes sense for your business sector. Put that in the messaging with your appointment booking details. And I think that's really helping people know that they need to come with masks. So thank you to all of you who are doing that, because it's really working well, it seems like.
Yeah, thanks, Cami.
Yeah.
And I'll finish up with these, and maybe Cami, if you could answer or address the last point here. But
yep.
In terms of gloves, wear them as much as you can. If you cannot, if your profession doesn't allow you to wear gloves while treating a customer or patient, we substitute that with frequent hand washing between patients or as regularly as possible. But really, gloves are a great tool. And a little caveat there, just remember that there should be gloves that you use for your clients and gloves that you use when you're cleaning the spaces. In terms of limited healthcare, I just wanted to reiterate that the mask for employees in limited healthcare settings must be medical grade, also known as a surgical mask. So that's for limited healthcare only.
And then just for personal services, because we know there's such a wide range of people who are business types that are falling into this sector, is that any of kind of the, I guess, beauty business types, so salons, hair, or body massage, or estheticians, anywhere where you're going to be getting closer than that 6 feet, you have to have a mask on the entire time, clients and staff. Those of you who are in more low contact business types, and some of the examples they've given have been movers, where you're coming into people's kind of personal space. You don't necessarily have to have yours on 100% of the time, like the high mass or the high contact services, but you still need to have one available to be able to quickly put on in the event you come within 6 feet of whether it's another the clients or people that you're working on behalf of or for.
Do you want to jump in,
Sure.
Amy? Or?
Yeah, so I think for a lot of you, this might be review, but for some of you who are new today on the webinar, Boulder County has been trying to compile all of the state guidance as well as the local guidance and make them available on our website for you. So at the bottom is the website, but some of the things we want to just highlight on here is, oh, you probably can't see my cursor. On the right-hand side of this page, you'll see there's a bunch of checklists. And we reviewed these each week in our prior webinars, but what we did was we pulled all of the general guidelines that all businesses have to follow, as well as the sector-specific guidelines or requirements that everyone has to follow, and put them in a single checklist. So you can come to our website, find the business sector that you're interested in, and for some of you, you're going to need to follow more than one. We know for personal services, a lot of you will also be needing to follow the retail guidelines, as well as possibly the office-based guidelines. Limited healthcare, same thing. You might have some retail or office-based happenings going on. So you want to, we tried to pull it all together so you wouldn't have to scour lots of different places on the state's websites to find all the information you needed. So that's a one-stop shop for you that we've tried to put together as a resource through Boulder County Public Health. And then the left side just lists a bunch of additional resources. There's a sample script for how to talk to customers about wearing a face covering. There's a space calculator if you're not exactly sure how many people can fit into your space and what the requirements are. We've tried to kind of give you a tool as a starting guideline. There is what to do if you think there's an outbreak. So check this out if you haven't already. It's a nice resource where we've tried to put a lot of, especially as we get more commonly asked questions, all in one place for you all. And then go ahead, Jesse. Yeah, just a couple of websites we wanted to spotlight for you all is covid19.colorado.gov. That is going to take you directly to the state site that has all of the safer at home requirements and additional and a lot of other great information. That is where we are pulling all of your requirements from. Also, Energize Colorado. This has a lot of you have heard about in the past. There was a marketplace that Colorado was putting together. It is now available. If you go to Energize Colorado, you'll be able to source some PPE. If you are struggling to find alternative sources, that is a great new resource that's been available for only the last week and a half, 2 weeks maybe. And then for those of you who are business areas that are regulated by DORA, please keep checking their websites as well. I know information has come out at different times and sometimes not quite fast enough or quick enough, and there's been some language discrepancies, but I think most of them have gotten cleared up. But also, but DORA has a lot of great details where they're taking the same information from the state site, trying to kind of digest it, put it in more frequently asked question language, a more digestible language. And so we've also linked to as many of those on our website as well to help kind of make it easier to find some of these resources. All right, Jesse. Yeah, just a reminder, or I guess if you haven't heard it before, even though we are the business liaisons for Boulder County Public Health and we're trying to help all of you open and stay in compliance, we can't provide you legal advice. We just are here to remind you that compliance with the state regulations is obligatory. You need to do it. The requirements are frequently changing, so it is upon you to stay up to date, and that's why we're providing these weekly webinars to try to make sure that if there are changes, we're messaging it as well, and that you know where to find the changes. Like we said, we're here to support you, but if you have really specific questions about what your agency or what your business can or cannot do, we recommend that you contact a personal attorney who can kind of get into those weeds with you, as we don't have the capacity to do that. And also, for those of you, because this is coming up more and more often, which is great that people are becoming aware, but An outbreak is considered if you have 2 or more employees that are either confirmed or suspected. You don't necessarily have to wait for a positive test to come back to reach out and basically get some help about what are you supposed to do if there's a suspected or confirmed outbreak. I know Corinne or the Boulder Chamber is going to provide follow up with this recorded webinar, but there'll be resources as well. And on our Boulder County website as well, there's a form that you're required to fill out and send in, and then Boulder County Public Health will work with you to come up with what are your next steps. A suspected outbreak or even a confirmed outbreak doesn't necessarily mean a business will be shut down. That's where the epidemiologist will work through with you individually to figure out what are the right next steps, but we need to know so we can start helping you right away and help you get sort of figure out what the next right steps are. Here's just some additional web or resources. Again, the first one is talking about the page that we have put together through Boulder County Public Health with a bunch of resources. The second link is the state's website. The energizecolorado.com is also that marketplace we talked about. And then there's a number of other local sources. Your chambers of commerce are also compiling a lot of great information. Local small business development centers are. Please, please, please follow your industry association recommendations. They're compiling a lot of best practices as well. So that'd be nice to see how are other people across the state or across the country doing things. They're listing a lot of stuff. DORA's kind of the licensing agency, and also just your cities or local municipalities on top of Boulder County are also trying to provide you with a lot of resources. And as we mentioned earlier, we are trying to have these weekly webinar sessions. We have combined the limited healthcare with personal services today for the first time. These two have very similar guidance and it hasn't changed much with the last update. So we figured it might be more efficient to combine these, where we know at 4 o'clock we've added a new session around personal training, gyms, and recreation. So that's sort of a hotbed of activity and questions right now. We felt like we needed to pull that out to be able to give it the time that it deserves, since there are changes within that field, but there wasn't necessarily in limited healthcare and personal services. So for those of you who have been following personal services kind of under the personal training wing of things, please come at 4 o'clock today, because we're going to get into that in more detail than we are in this session right now. And then on Thursdays, here are your standard sections if you're interested in any of these other webinar sessions for manufacturing, retail, hospitality, and the general office industry. And then it's wonderful, every Wednesday moving forward, there's going to be Spanish sessions that are conducted in Spanish. The Latino Chamber is partnering, just like all the chambers are, to kind of help put this on. And those are, I believe, actually, I'm not 100% sure of the time. We'll make sure that gets shared in the follow-up materials to make sure I don't misspeak, but I believe it's at 6 or 7. It's an evening session, I believe, but we'll confirm that. And so right now, we wanted to open it up to you to use the Q&A function with that's attached to the webinar to say what questions do you might specifically have for Jesse and I right now. And then we also want to invite you to share what would be helpful in these sessions moving forward, knowing that we may not get necessarily new updates next week, but we might. How can we help, and what would be helpful either to review as topics or resources to go over? Let us know in the Q&A session as well, as we get sent all that feedback, so we'll be able to see it after the session.
And hi everyone, this is Zach Swank, also with Boulder County Public Health. I'll be handling the Q&A today. First question is, are there any changes to personal services, particularly body art, with this latest update?
There were not. So we're all sort of following the same guidelines as we have been the last few weeks, pretty much most of May, or since May 9th.
Great, thanks.
Mm-hmm.
And then regarding outbreaks, if an employee at a salon tests positive, does every person who worked with that person need to quarantine, which would close the business?
No, good question. So I think first thing to do is we can go back. I don't know if we have the form pulled up. We could look at it. I don't know, Jesse, can you?
I don't have the form pulled up. Do you want me to? I can probably go search for it if you want.
You
You
can
click
also
on
click
that.
on the link in the
Can you click on the
presentation.
link?
Look at that. I could just click on the link.
There you go. Yeah,
One
so
second.
just to read it, even if there is a positive outbreak of even more than one person, it doesn't necessarily mean the business is going to be shut down. Definitely any staff members that you know of that may have been exhibiting symptoms, even whether they've tested positive or not, but if they are confirmed, for sure need to go home and have a 14-day quarantine period. And then if you reach out to Boulder County Public Health, we can help you also sort of assess, and we follow up with how many other people might be suspected or how many other staff members are showing symptoms. And we'd start from there and then get you connected to the epidemiologist who would help kind of work on a plan that's specific to your business and makes sense for what sort of risk factors are in place.
Are you all seeing this form now?
No,
Okay.
no, I'm not.
All right. Let me switch to a different share. Should be now.
Yeah, we can see it now.
Great.
Yeah.
So I just wanted to.
So you can kind of, yeah, see how the red boxes up top will sort of guide you through what you do, whether it's confirmed or what you do, whether it's suspected, but this form will kind of give you a little bit more of those details you're probably looking for. But just to reiterate that a positive case is not necessarily directly equated to an automatic business shutdown. And I know a lot of people have been worried about that. We don't want you to be worried to report that there are suspected cases in fear of your business being shut down, because it's not necessarily automatically going to happen.
So Cami, what should a business do if they have a positive case or two positive cases or two suspected cases?
Yeah, and I think part of that would be definitely, that was the value of having those logs that you're all taking, or that you should be doing, is that businesses under personal services and limited healthcare should be keeping track of staff logs and client logs for the symptom checkers. So we can go back and see who else might have been interacting with those folks, but you can follow up and do definitely more cleaning, frequent cleaning, go back and ensure all of the places where that sick staff member might have been working for that day, send them home right away, and then definitely clean up that area as quickly as possible. And all the materials and what's the word I'm looking for? All the products, I guess, or materials that they've been working with that day, for not losing my words here. And then make sure that they have the support as a business owner that they might need when it comes to how do they contact with the HR folks to get maybe the support that they would need as the staff person, why they might be home. You would want to possibly then reschedule, obviously, all of their clients who are not, they're now going to be unavailable, and get them reassigned. But you'd really want to first and foremost then just make sure that the area is clean before any other new clients come into the area where that person had been working for the day, or staff members for the day. Is that kind of what you were looking for, Zach, or did I miss the mark?
No, that's great.
Okay.
And I would just add also email Boulder County Public Health at COVIDBiz, B-I-Z, at bouldercounty.org, and we'll help you evaluate what steps are required next. What if someone is tested and thinks they had a false negative?
What if someone says and thinks they have a false negative? So that means they're assuming they are sick and they didn't test positive. Am I interpreting that right? Yeah, I think if anyone feels like they are sick, they should stay home, and they should, businesses should be supporting anyone who feels like they are sick to stay home, and then quarantine, and then hopefully those folks have connection to whether it's positive or be working with their own healthcare providers as well. But I don't know beyond that what other guidance we might be able to provide, other than, anyone who thinks they're sick should be allowed to stay home from work, and businesses should then kind of reschedule or work around kind of the staffing issue that might come up. So no one is coming into work when they are feeling like they might possibly be a risk to others.
Yeah, I would second that. The risk is it's just not worth it.
Not worth it.
Understanding that frontline workers need PPE the most. The Energize Colorado website has not been any assistance for gloves or surgical masks. They're perpetually out of stock. Any word on different vendors?
Not that
Where else can folks find different sources of purchasing PPE?
I know a lot of, especially from the personal services folks, a few weeks ago too, had shared that there's some local businesses who are sharing PPE or that are selling PPE out of their stores and have some availability. And we put together a resource list that I believe is up on the Boulder County website, that has not only Colorado, or excuse me, Energize Colorado listed, but some other sources as well up on our website for where you can source PPE.
What is the protocol for retail sales in a body art business?
Yeah. So what first place I would do is definitely make sure you have the personal services checklist handy, as well as the retail checklist that we've created from Boulder County's website. It will walk you through the differences. There's definitely some great best practices listed in there, as well as what the requirements are for the retail. And I don't necessarily have all the retail off the top of my head. They'll review that in the retail session, but I know it's listed in the checklist and the additional resources for retail.
And I think that's a great point, is that there are many businesses that are, office, you got an office, but you also have a retail front, or, your personal services, but you also do retail, et cetera. So, you would apply the relevant checklist to that portion of your business.
Yeah. And just as a general, if it makes sense and it's doable, we're still highly recommending curbside as much as possible, curbside pickup for retail, instead of necessarily coming inside. That may not work in all situations, but just to keep that distance between services that are happening inside versus retail sales that might be able to be managed in a different location, we are encouraging curbside as much as possible when and where that makes sense.
We got a question about, is the Boulder Chamber going to send follow-up after these webinars? Yes, they're great about doing that. If you are not getting them, you can reach out to us at COVIDBiz at this email. It's on the screen, and we'll forward that in for follow-up to you.
And all prior webinars, if we haven't said it before, I sometimes get lost in what webinar I say it in, but they're all being recorded. So if you wanted to go back and look at the few weeks earlier, you can do that as well if you had the time or if you were interested.
So the current Safer at Home order expires June 1st. Will there be a new order? And if all state level orders expire, do the state and county COVID regs and regulations expire as well?
Okay, that was a multi-part.
Yeah, we'll just take the first one.
I was like,
so
okay, hold on.
Safer at Home expires on June 1st. Will there be a new order?
Yes, most likely Safer at Home order is going to be extended, and we're going to be in it for months and months and months. There'll be updates along the way, probably multiple, more than just this one. So we're expecting more updates on June 1st and then ongoing after that. We don't know necessarily in advance when the governor is going to give out more and more updates, but we know there's still a lot of sectors that haven't even been opened yet. So we do expect that we'll be in the Safer at Home phase with many updates for months and months and months. But we can't predict necessarily what sectors are going to get updates when. Every once in a while he announces a few details like he did this last time for a few business sectors, but not always.
And I would just underscore that point, as was said earlier on this webinar, until we have treatment, until we have a vaccine, we will continue to need to have protocols in place to limit the spread of COVID-19, and that is going to be months. Each time an order, reaches its expiration date, it's really a date of, where the governor has indicated that there's going to potentially be some changes to the order. So we're going to continue to see these dates set out in the future, but it would be a mistake to think that, at any particular one of those dates that, all orders would then be lifted after that date, and we're going to go back to the way things were at the start of the year before the pandemic came to Colorado. That's just not going to happen until we have treatment or a vaccine. But to the second part of the question, whenever that happens, a year from now or 6 months from now, once all the orders actually do expire, and we have an effective means of controlling COVID-19 besides so physical distancing, social distancing, limiting contact, et cetera, then yeah, then they would all expire, and the related regulations would expire. But I would not be anticipating that that is going to happen anytime soon.
And also just a little bit more on that, and Zach, you may be able to address this better, but in terms of the layering of the regulations, it's my understanding that if the state were to remove their regulations or remove a set of regulations, at least the way it's structured now, the county's regulations would still stay in place unless there was something from the state that said that all county regulations no longer have validity or something.
Correct. Yeah, and that would, the state saying that, you know, all county regulations needed to be lifted would be a highly unlikely scenario. So, yeah. In all situations, whichever order is more restrictive, you know, between the state, the county, the city, that's the one that applies. So we have a couple of questions related to timelines. Is there a realistic estimation of when esthetician services may be able to provide full service treatments, or when body art professionals may be able to access under the mask area?
I know you all are so desperately wanting to know. I feel for you too. I know, I wish I had a clearer answer, but we just don't know when that timeline will happen. I think the estheticians and even the body art, but because you're in such close proximity to nose and face or in mouth, you're gonna be further down the list than a lot of other people potentially because of that high risk scenario and how the virus is transmitted through droplets. So I can't give you, I don't want to discourage you or encourage you falsely, but other than saying we just don't know when you're going to be allowed. But as of now, you are still not in anything that has to do with this area. And I know there were some schools left, some training schools that we're talking about, and I don't know if we've been able to respond to you directly. So if you're on the line about how can we train the next generation of providers, and can we move the mask slightly just to be able to do and know, because especially with everyone's been breathing underneath that mask and all of those droplets are still basically on that skin area now, you don't want anybody, whether it's the client themselves or staff or trainees, to be touching anything around that mask because of cross-contamination. So just no messing with masks to make things happen, and definitely no area that needs to be required or that is required to be covered by a mask is going to probably be an eligible area for service anytime soon.
So 2 questions about the maximum number of people. So with restaurants opening up, will personal services be able to open up to more than 10 people at one time in a single space?
Great question. And I was honestly, that was the first thing I looked for when the order came out today, was to see if that was going to change, because I knew that was going to be a question that logically came up for not only myself, but all of you. And there just wasn't any language change in it. And we don't know when that language will change.
And then we have a different flavor of that same question. For a studio, massage studio with individual rooms, when might they be able to increase to more than 10 people?
Yes, good question. Again, don't know the time frame answer, but as long as you have like the 4 walls and the door, you are able to treat each one of those spaces as kind of the 10 max. If it's just shared space where there's stations and they're not separated by 4 walls, you're at 10 max for that building, regardless of how giant the building is, even if you can maintain way more than 6 feet of social distancing within that larger space. So it really does come down to that 4 walls and a door to be able to say if you're at 10 for the building or 10 for the space, if that makes sense. I hope that differentiated clear enough, but.
Are there any other questions? If you have any other questions, do put them in the Q&A feature.
And like we said, we're going to get into the weeds around the personal training, the gyms, some of that stuff, the rec stuff, and how a lot of these sectors have some overlapping connections at this point. And we're going to dig into that in the next session a little bit more.
And yeah, just one other thing as well. If you do have things that either you want some more detail on or next week you want us to dig into, please email us, and we'll focus on that for next week.
And I'll just plug, if you really have recommendations you want to be considered for timelines and guidelines, really be connecting with the state. It's really the state rules and laws we're following. It's not Boulder County per se making the decision about these. I mean, we're not at all. We're just a messenger of the state's orders. So feedback to the state is really the great place to kind of pass this stuff up if you have strong thoughts about what they should be considering next.
So we have one more question come in. Can I have retail clients in the building at the same time as I'm providing personal services in this example body art?
Yes, but you still have to maintain less than 10 in the building at a time. So that's a kind of a control management plan piece, and why we're encouraged to do curbside pickup if you can, because it won't necessarily trip you up with the number of people that are in the building at the time. All per se, unless your body art areas are walled off and you can shut doors, then you're under kind of a different scenario. But if it's a shared space with just open doors or open walls, or kind of, you know, not fully contained room separation, you would still have to factor in retail clients coming in. That may take you over that 10 max. So they'd have to wait outside or whatever it might be until a client is finished. So it creates some complications. So that's why we're still encouraging curbside, because it might make having to kind of follow both guideline sets a little bit easier if you can separate somehow retail from the services, which I know a lot of salons are in the same situation right now too.
And for a personal services provider, is an appointment required for retail?
Not for retail. It might help. Like it might help control the flow, but any personal, well, that is a very good, that's a nuanced question, because it does say all services require an appointment, no walk-ins.
I mean, I think if that retail client doesn't become a personal services client through the conversation, they might be able to be in there without an appointment. But that is, you're right, that's something we ought to dig into.
Mm-hmm.
Yeah, this sounds like a good one for us to follow up on.
We'll follow up, yeah, for sure, because that is, the language does say appointment required, but it doesn't specify the difference between a direct service being provided and retail being provided. Yeah, so thank you for bringing that up.
All right, well, any last comments, Jesse or Cami, before we close?
No, just thank you all for your great participation and feedback so far. And we really look forward to reading what you submit today as far as things we should look into more or what you want more on, because that'll help us prepare for next week.
Yeah. Thanks.
All right. Well, thank you, Cami, Jesse, and Zach. I'm Tyler X with the Boulder Chamber. Corinne had to run to another call, so I'm just going to close out for us. But thank you all for participating and to get the newest information, ask questions, provide back. We'll continue to hold these every Tuesday at 3 for limited healthcare and personal services. And you can use the same Zoom login you used today or register for the next session. I want to again thank all of you and the local chambers and our economic development partners for their service. And I especially want to thank Boulder County Public Health for dedicating their hours to our businesses to serve both our health and our economy. So we will see you all next week. And like they said, follow up with any additional questions you may have.
Thank you, Tyler. Thank you, Chamber. Thanks,
Thank
everybody.
you.
Bye.